we're going to start with getting ourselves familiar with what is a medical record, right? For clinicians, nurses, who else? Clinical lab scientists. You guys know what a note is, what a clinical chart, what is a medical record. You guys know that, right? But for many of us who are not medical people to begin with, we need to understand what is a medical record, what is a patient chart. Okay, a medical record, guys, they're called many different names. At least in our industry, they're called sometimes they're called progress note, they're called encounter note and whatnot, right? But what is important is to understand what is in there, okay? Because this is going to be crucial when you start reading medical records. Especially when you're already at work and you're looking for a specific information. There are specific information that you can only find in that particular part of the note. So it is highly important for coders to get yourselves really soaked in your understanding what a medical record is. Okay, when you talk about medical record, it is the entirety of course, of everything, all the information that clinical information that are necessary to be reported in the patient's record, right? So you have the diagnosis, you have the plan, the medication, the labs, what else? The X-ray, the referral, the medications, and there are so many of them, right? So it is important for us to be able to determine which part of the chart you're to look for those information. Okay, so that is a medical record. It is the entirety of the patient's clinical information that are reported in one document. Now, when you talk about medical record, guys, okay, when you talk about medical record, um, depending on what clinical setting you are reading a note from, okay, this clinical record or patient record are formatted in many different ways. But there is a general format of the medical record that is very much, similar, or you can definitely say that it's a pattern that clinicians follow when they're writing their notes. Okay, when I say note, guys, I'm talking about the generality of the doctor's record or the doctor's documentation. When people, talk about medical record in the clinical setting, and when they say note, we already have that understanding that we're talking about the patient's record, the patient's chart. Okay, so we don't have to elaborate what kind of note it is, but the term note refers to or defaults to the medical record. Okay, so there are many different notes, and we're going to talk about that, in a little bit. But in the meantime, guys, how do we determine the different format or the structure of a medical record? This is how you determine. In generality, there are three main components of a note, okay, of a medical record or a progress note or a patient's chart or clinical chart. People, in this business call it many different names, but we all agree that when we talk about progress note or just note, we're talking about the medical record. There are three main components of a medical record. Mainly, let me put that in the board here, guys. History, okay? Yeah. Okay, so these are the three main components of a progress note. So you have the history here, you have the exam, you have the medical decision making. So let's understand what are these different components here. What do they contain? Okay, what are in these components that you typically find in a patient chart? Okay, so for history, guys, we're talking about um, the clinical information about, the part of this is the history of present illness, meaning, okay, let me write it down. HPI. Okay, so my HPI or history of present illness. Okay. Now, for the history of present illness, guys, we're talking about a part of the chart where the patient narrates her story or his story. Okay. So let's, for example, say, for example, a patient was admitted in the ED department because of, patient experience or just had a ground level fall, or sometimes doctors call it GLF or just fall, right? So patient came in, brought in by a relative or a family member because they saw the patient lying on the floor, unconscious. So was brought to ED. The history of present illness, guys, is part of the note where all these narrative, how the patient fell, what time the patient was seen by the last known witness, what was the patient taking, if the patient was taking medication, or what was the patient current condition, why patient fell. Maybe the patient is intoxicated, or patient had a drink or two the previous night and accidentally tripped, something like that. So this is your history of present illness. Basically, the patient is conveying her or his story to the clinician. And most of the time, the history of present illness, guys, are elicited um, by a medical assistant, or whoever is the first clinician that the patient encountered in that visit. It sometimes it's the LVN, sometimes it's the medical assistant, sometimes it's the nurse itself, or sometimes the doctor themselves, who, depending on whoever is available in the, when the patient came in the ED, in the ED clinical setting. So the history of present illness, guys, basically is the background of the story why the patient is in the clinic. Okay, we call it HPI, or again, history of present illness. Another part of the history is we call it PMH, or past medical history. Again, there's so much history here, but understand the difference, guys, of this different items here. Past medical history. Okay. When you talk about past medical history, you're basically looking at patient's other conditions. So if a patient fell, right, brought into ED, it is important for the doctor, whoever is treating the patient, to know what is patient's background in terms of the medical history. If a patient, if a patient is kind of like way advanced in age, what are those other conditions that patient is suffering from? Like maybe the patient has hypertension or hypotensive, orthostatic hypotension. What else? Maybe patient is diabetic. Maybe his patient has an atrial fibrillation. So those information are listed mostly, for the most part, in the past medical history. Okay, PMH. Sometimes the past medical history are also called as active problem list. Let me write it down here. Active problem list. Okay. So they are used interchangeably, active problem list and past medical history. For the most part, they mean the same. Okay, but let me just give you some of sort of a disclaimer, guys. Okay, when the doctor puts information in the active problem list, they don't necessarily mean they are current. I know it's an oxymoron. I mean, this day and age, we all know that people copy paste, right? That's one of the features of the technology right now that make it easier for anyone to just transfer information from one chart to another chart, right? From the previous previous note to the current note. So that's the reason why when you look at active problem lists, they don't necessarily mean that this condition is current. Let's say, for example, patient had just this morning, I was talking to my daughter because she was looking at the chart. She was auditing a chart, and she was asking me, "Hey, Dad, a patient had a procedure. Part of the colon was removed because patient had cancer." So she was asking, "Do we still code cancer?" Well, part of the colon, a significant part of the colon, had already been excised and resected, and question is cancer still active or not? But it's still in the note saying patient has cancer. So, I mean, that's another topic for another day. But what I'm trying to say, guys, is that as a disclaimer, like what I'm saying earlier, that active problem lists don't necessarily mean they are current. So let's put it that way, okay? There's still a lot of work to do when it comes to updating those active problem lists or past medical history. Now, another part or the next part that I want to share with you guys, history also covers what we call the medication list. The medication list actually is a sub part of the past medical history, but it is part of the history. Okay, medication list. What are these drugs that our patient is currently on? Like, if a patient is diabetic, is a patient on insulin? What kind of insulin the patient is taking? Right? Is it an oral insulin or is it injectable insulin? If a patient is on oral hypoglycemic drug like metformin or Jardians, and there are many of those guys that are popular out in the market. What else? If a patient also on antihypertensive medication, is a patient on Coreg, patient is on Metoprolol, the medication list lists all these medications. If a patient has a respiratory disorder, maybe patient is on Ventolin or albuterol or something like that. Now, just as I have told you guys, the active problem list and the medication list do not treat that as a current information. What I'm trying to say is that many a times these medication lists is also not updated. Sometimes patient, had a history of depression and patient got over it, but you see the depression drugs are still listed in the medication list. So you got to really be careful and I mean in like using that information, because like I said, there's no perfect chart, there's no perfect note, guys. And this is the reason why there is another health professional or health information professional like myself. I had that certification. They call that certification CDI or CDS, the Clinical Documentation Integrity or Clinical Documentation Specialist, which I have a certification too, and that's what I do in UC Davis as a full-time job. What we do in that process is we try to update the information, like bring it to the providers or the doctor's attention if patient still has diabetes, if patient still has a cancer. So it is our job as the type of health information professional to query the provider what these conditions, if they're active or not. Okay, but for you guys, for you being coders, like I said, whatever is listed in the doctor's note, let's be careful in using this information because not all clinical information listed there are codable. And let me say that not all clinical information or diagnosis in the note are codable, and we will get into that in a little bit. Okay, so you have the medication list, you have the HPI, you have the PMH, you have another part of the history is patient's social and family history. Okay, social and family history. And I don't need to elaborate what a family history is, like, because I'm pretty sure, guys, every one of us here had already been into a clinic, a doctor's clinic. And when you go to the doctor's clinic, even for a simple, say, simple visit to an optometrist, right? You go to an optometrist. If you're new to that clinic, they're gonna have you fill out a note or chart, right? Or a document and asking you all of these information. Does your family have a history of diabetes, liver disease, hypertension, myocardial infarction, right? Does your family have a history of stroke or heart attack? So family history is about that. Okay, and why is it important? It is important because the doctor needs to know if this particular patient is more of like predisposed to a specific condition, right? If you have a family history of cancer, chances are, I'm not saying let's keep our fingers crossed, chances are you might be able to inherit the gene, right? You might have inherited a gene for, to being predisposed to that kind of disease as well. If there is a family history of diabetes, like I do, my mom and my dad are both diabetic. So there is a strong chance that I become diabetic. Matter of fact, I'm in the borderline that level. Okay. So family history is part of this major component. What about social history, guys? Okay, social history is basically the rest of the information that I would say also an important determinant for the doctor to be able to make a better judgment of what you may have or what causes the disease. Let's say, for example, the one that we the example that we used earlier was patient was found unconscious, right? Patient could be intoxicated, something like that. That alcohol use, if a patient is has a pattern of alcohol use disorder, it is found in the social history. Okay. Now, in the social history, if you guys, I'm pretty sure you guys been to the doctor's office. When you are being interviewed by the nurse will interview or will ask you guys whether you exercise or not, right? What is it that you do? Okay, are you a say, do you work in fast food business? Do you work in an office? Do you smoke? Do you use drugs? Do you what else? Are you married? So are you, what kind of work environment that you do? Are you a bus driver? So all of those are listed in the social history. Okay, so to kind of like sum it up, guys, the history part of the progress note tells everything about the patient. Basically, one look at the HPI here, the PMH medication list, social family history, the doctor can already form his potential diagnosis, right? So if a patient was found unconscious, if a patient is too old, like maybe patient has some kind of balance issue, right? Patient might have these cognitive impairment, bordering dementia, something like that, right? Or maybe patient has Parkinson's. So all of these by just reading this part here, the history, even myself, guys, as a seasoned coder, a clinical documentation specialist, I can pretty much sum it up. One look at the history, I can offer my best judgment what a patient is coming in for, or what a patient's condition is. Of course, you still have to review the entire note, right? So that is your history, okay? Any questions so far, guys? You can unmute yourself if you guys have a question so far.
Good so far, sir.
Good so far? Okay, so so far so good. Now, if you guys have any question, please don't hesitate to interrupt me because I don't want to forget your question. Let's go to the exam. So the exam, guys, is basically the part of the note or the medical record where the doctor works, performs what he needs to perform, right? So the doctor will look at the entire body system. I hope he does, right? Or she does. So the exam, there are different types of exam that the doctor performs. The most the most popular one or the most common one would be inspection, right? Okay. So we know what inspection is. The doctor has his little pen light, looks at your throat. Speaking of throat, guys, last night, actually, my throat is kind of itchy already. I had a scratchy throat coming from, from LA. And true enough, I'm kind of like under the weather right now. I think there's some viral activity going on right now, little cold and low grade fever, stuff like that. But hopefully, I'll be able to recover soon. But what I'm trying to say is that inspection is the most common one, right? So the doctor has pen light, look at your eyes, with the color of your eyes, look at your ears. The doctor will look at your throat and see if there's any inflammation, in your oral cavity right there. Okay, that is inspection. And the doctor is doing what? The exam. Sometimes we call it physical exam. Okay, what else? The doctor does palpation. Okay, is it clear enough? I think it's a little pale, right? You know what? Because this is a new let me switch to the other pen. So we started with inspection, palpation. So obviously, when you talk about palpation, guys, you talk about the actual physical touch that the doctor performs, right? The doctor will look at the side of your neck, right? He will or she will feel the side of your neck. And what does the doctor is trying to establish there? The doctor will try to establish whether you have an inflammation of your lymph nodes, right? If your lymph nodes are kind of inflamed or active, the doctor will be able to feel that. What else? The doctor tries to feel the tenderness, if there's tenderness of your stomach, right? If it's tender or is it distended, things like that. So the doctor will try to explore your stomach, whether there was some enlargement of an organ. So the doctor can feel that. That is palpation. This is the actual physical touch. Okay? Now, what else? The doctor does auscultation. And what is auscultation? Of course, auscultation, just like inspection, is a very popular. The doctor uses a stethoscope. Everybody is familiar with the stethoscope, right? Nurses, you also do that. So what does the doctor, how does the doctor perform it? The doctor would even put the stethoscope in the side of your neck. Why is the doctor doing that? Anyone has an idea? Nurses, you guys, you ladies know that, right? Or you guys know that. Why does the doctor Try to listen to the side of your neck. What is the doctor trying to establish there? Anyone?
Heart rate? Not sure.
Heart rate? um,
The heartbeat.
Heartbeat from the carotid artery.
Beat. Yeah.
there you go. So that's Manny.
Yeah.
Carotid artery. Yes. The doctor is listening to carotid artery. We have two major arteries here, guys, the side of our neck, where the blood coming from the heart, channels to the brain. So that's our carotid artery here. So the doctor's trying to listen if there is a smooth, flow of the blood going to our head. That's what the doctor's trying to listen. If there's any brew, if there's any whooshing sound, things like those. So he needs to hear that. Okay. The heart is a little far from that. So the doctor also listens to your heart by putting the stethoscope right in front of your chest where your heart is. So that's where the part of the doctors listen to your heartbeat. If there's any skip, if there's any irregular heartbeat. So that part of the inspection, guys, or exam, or not inspection, auscultation, the doctor is trying to establish, if there is anything that he or she must be concerned with when it comes to your cardiovascular health. Okay, what else? Sometimes the doctor also the other part the doctor does using that auscultation method is he listens to your lung, right? So the doctor will put the stethoscope in your back, okay, and listen to your lung sound. Okay, if there is any wheezing or any high pitch like stridor, or was there any crackling sound, if there was any labored breathing. So everything there is determined, okay, is determined through this method here, auscultation. And the last one that I can't think of, and if I'm missing something, guys, let me know, is percussion. Okay, percussion is part of the exam that the doctor performs. So how does the doctor do it? The doctor sometimes will, if the patient comes in with complaining of abdominal pain, so the doctor will place a couple of fingers and try to do some tapping on the abdominal area to see if the patient is like gassy, or if there's any distension of the abdomen. What else? The doctor also do some tapping of your knee if your reflexes are still intact. So that's percussion. Okay. And what else? Am I forgetting anything, guys? Nurses, you perform this, right? I think that's all there is, right? Carol, you switched to outpatient clinical setting. Which part of this do you perform? I don't want to put you on spot, Carol, but what I'm trying to say is these are all performed by a clinician. Okay, sometimes an NP or a PA would also perform this in place of the doctors. Okay, so we're done with the exam. We're done with the history of the exam. Now let's go to the medical decision making. The medical decision making, guys, is basically this is the doctor's final verdict. Okay, the medical decision making is the part of the chart where the doctor documents his assessment. Okay, so an assessment will have to contain, or assessment contains many different items also, many different information, clinical information. So, of course, the final decision of the doctor is the diagnosis, right? Sometimes they call it impression. Okay, sometimes they call it impression. This is where you see the diagnosis, the labs, okay, the imaging, labs and imaging, okay, medication, treatment, they're all here. Okay, assessment, impression, diagnosis, lab. Matter of fact, the treatment, guys, is actually part of the plan. Okay, the treatment is part of the plan. Now, we now know that when the doctor makes his decision, if the doctor finally after reading all this history exam, doing the exam, the doctor will come up with his diagnosis, right? If he finds that the patient's reason or cause for fall is about patient is demented, then he's going to put the diagnosis here. Patient has dementia. If a patient has Parkinson's disease or suffering from episodal convulsion, then the doctor will put here seizure or epilepsy or Parkinson's, right? If the doctor has alcohol use problem, then the doctor will put in the assessment if the patient has alcohol abuse disorder, things like those. Now, in the assessment, you will also find the labs. But most of the time, guys, when the patient comes into the clinic, if the doctor needs to investigate or probe further, he would order this procedures, this labs and imaging. If it's a simple, case of patient is just coming there for a headache, maybe the doctor will just recommend an over-the-counter pain medication like Advil or Tylenol, right? But in some cases, if the doctors want to make sure that he is diagnosing correctly, so he would order for these labs and imaging, and those results from labs and imaging are found in the part where it says assessment. Okay? And lastly, guys, the plan right here. The plan is the part of the chart where the doctor, of course, recommends treatment. If you need an over-the-counter medication, then that's where the doctor puts it in. If you need a repeat lab because your previous, glucose level was a little bit too high, then the doctor says, okay, Mr. John, you need to do another lab, and I want you to come back, in the next 2 or 3 months and see how it goes. Okay, see if you're able to bring that glucose level down. If a patient, has a like weight disorder, like weight issue, then like I do, a little bit obese, right? So the doctor will have to assess, or recommend a weight loss plan or education or diet, something like that, diet plan for the patient. So everything is in the plan. Now, if the doctor wants another, like a professional opinion from another doctor, he or she would also put it in the plan, like you are going to be referred to endocrinologist or weight loss specialist or physical medicine and whatnot. These are all part of the plan.